Hi, nice to meet you. Would you like to introduce yourself?
My name is Kelly Miller. I'm actually Taylor McCafferty's mom, and I work as a medical assistant.
Well, so what does that mean?
My job is to do everything the doctor doesn't want to do, which means when you come in, I bring you back to the room. I go over your meds. I go over your history. I take all your vitals, meaning blood pressure, all that fun stuff. And then you get to tell me all the hard stuff that you don't necessarily want to tell the doctor anyway.
Yeah. So what inspired you to become one?
My whole life, I've actually been helping people in general, from my little brothers, because I have 3 little brothers, to having Taylor at a young age. And, I've always taken care of people, including my mother, my father, and all of that. So I figured, why not get paid for it now? So that's kind of part of the reason why. Plus, I like old people. I know that sounds bad, but the older the better. They have better stories.
What was the process like to becoming a medical assistant?
There is schooling. It's a technical school. I went to Ridley Lowe. That's no longer in business, but it's a 3-year course. So they teach you everything from basically what a nurse would do. You're just one step below that. I know how to give meds. I know how to draw blood. I know how to do vaccines. I can do all of that. Connecticut is just finally catching up to where the medical assistant can do that.
Oh, wow. So what would you say would be the skills that you would need to become a medical assistant?
Well, first and foremost, you've got to be able to communicate. I mean, that's just, you have to have some kind of personality. You have to, you have to like people. I do while I'm at work. When I'm home, I don't really talk to anybody, but you do, and you have to be friendly. You have to know how to be, you have to have compassion, because people are coming in, they're sick, or they're not sick. They're just there because they have to be. So there's that. And then there's always computer skills. Then, all the clinical things that I mentioned before. So,
Yeah. So you mentioned earlier about nursing and like certified nursing assistants. What's like the difference between like what you do and a certified nursing assistant?
Well, a certified nursing assistant can do the same job I do. They don't go to school like I do, or like I did. Also, they typically are in like a home setting, more like a convalescent home or a rehab or something along those lines. And they do a lot less of the clinical things. Like they're usually helping people get, dressed in the morning, feeding them, things like that. I don't have to do those things. So so that's pretty much the difference, I think.
Yeah. So what would you say is the difference between what you do and a registered nurse?
It depends on where you work with that one, okay? If you're in the ER, nurses are pretty much do everything I do. But in my field, because I'm in a doctor's office, which is a primary care office, my nurses pretty much just kind of sit there and they answer phone calls, and they answer, like if you call and you're not feeling well, she's gonna be the one who gets on the phone and she's gonna ask you all those questions. Do you have a fever? Do you have this? Do you have that? So their main job is that, and giving vaccines, because as I said before, Connecticut hasn't caught up to the law where a medical assistant can do that, so they're solely there for that, which is why I didn't do registered nursing, because I don't want to just sit there. I like the people. So
What would you tell someone who is interested in becoming a medical assistant?
It's a lot of work. After the schooling and everything, you just have to have the patience. You know what I'm saying? Like, I know I've been yelled at, I've been screamed at, people have called me names, it's things like that. You have to be able to take that kind of stuff. You need a thick skin in order to be able to do it. And again, you have to like people.
What's something that you wish more people knew about what you do?
I wish they knew that if they come in and they start talking to me, they pretty much need to tell me everything. I've had patients who have not told me certain things, and they've told the doctor, and then I've got to go back in the room, and it prolongs your appointment. If you're not feeling well and you go in and I say, is there anything else you need, or is there anything you want to talk to the doctor to, you should probably tell me. Because especially if you're having a sore throat or if you're not feeling well, my job is to keep him from getting sick, my doctor, and I can do the swabbing, I can do any testing beforehand, so he has the answers when he comes in the room. So that's my main thing. I wish they knew that to do that, because a lot of times they're like, oh, well, I'll just tell him. I'm like, okay, well, I'll be back,
That's interesting.
I know a lot of people do it and they don't get it, I've had one patient who literally didn't tell me something, and then it turned out to be a huge something. And then I was in the room, and then there's another MA in the room, and there's another, somebody from the front desk trying to schedule things. I mean, it gets to be I thought it was funny because I even told them, don't ever lie to your nurse. But, you know.
Yeah.
So.
Yeah. And just to wrap up and stuff, any sort of advice you'd like to share?
Just know if you want to be in the medical field like I am, you definitely want, like I said, to be a people person. But it's good to find a doctor you like to work with. I've been with my doctor for almost 8 years. I was with him in New Fairfield. He moved to Litchfield, and now I follow him there. You have to like the people you work with, or you're not gonna have fun.
Yeah.
So, you know, and it can be fun if you like everybody.
Yeah. Well, thank you for speaking to me today. This was a lot of fun.
Absolutely. It was nice to meet you.
Nice to meet you too.